Welcome back to Diabetics with Files, where we uncover the science behind wounds, infections, and then salvage. Today, we're going to talk about a technology that sounds almost futuristic, a test that allows us to look inside the body without taking traditional tissue samples, a technology that already changed cancer care and may one day transform how we diagnose infection, inflammation, and healing potential in diabetic foot ulcers. Today, we're going to talk about liquid biopsies. Could a simple blood sample tell us whether a wound is healing, whether a wound is failing, whether a wound is infected, or whether it's heading towards limb loss? So, what is a liquid biopsy? A traditional biopsy means removing tissue from the body, that's why it's called biopsy, and examining it underneath the microscope. For example, taking a skin biopsy, or taking a bone biopsy for osteomyelitis, or taking a tumor biopsy for cancer. A liquid biopsy is different. Instead of cutting the tissue, they analyze the materials floating in the body fluids, most commonly blood. So a liquid biopsy looks for something called cell-free DNA, CFDNA, cfDNA. So every day, cells in our body naturally die, release fragments of DNA into the bloodstream. These DNA fragments can provide clues of what's happening inside the body, just like we take any blood sample, right? And in cancer, abnormal DNA fragments from tumors can be detected. In wound care, researchers are studying whether changes in circulating DNA can tell us about inflammation, tissue injury, immune response, and healing activity. So, why does this matter when it comes to us, when it comes to our interest in diabetic foot ulcers? A diabetic foot ulcer, of course, as we know now, is not just simply a hole in the skin. It's a biological battlefield involving inflammation, immune cells, bacteria, oxygen delivery, growth factors, and tissue regeneration. And a liquid biopsy may someday help us understand what stage of the battlefield the infection is in, right? Or that wound is in. So, who invented the liquid biopsy? Liquid biopsy was not created by one person. It actually resulted from decades of discoveries. So, an important milestones are like in 1984, they discovered the cell-free DNA. Researchers discovered DNA fragments circulating in human blood. This created the foundation of liquid biopsy technology in the 1990s, which is very recent, circulating tumor DNA research. So scientists discovered that DNA released from cancer cells could detach in the blood, and this showed that diseases could leave some molecular fingerprints in the circulation. Now, in 2000s, the term liquid biopsy became popular. Researchers began using blood based testing to detect cancer mutations and monitor treatment response. And today, liquid biopsies are being studied in oncology, infectious disease, transplant medicine, prenatal medicine, and inflammatory diseases. And now researchers are exploring it in a wound care application. So, how does liquid biopsies actually work? So, I'll walk you through the process. Step one, blood collection. So, a patient gives a blood sample similarly to just a routine laboratory testing. No surgical biopsy, no cutting, and no tissue removal. Step two is separating the blood components. The laboratory separates plasma, DNA fragments, RNA, and extracellular vesicles and other molecular signals. Step three, molecular analysis. Advanced technology analyzes these signals. Methods include next generation sequencing. This reads genetic information and looks like a particular pattern. PCR testing, this amplifies the tiny amount of genetic material so they can actually be detected. Biomarkers analysis, this looks for biological signals associated with disease activity. So, how can liquid biopsies change diabetic foot ulcer care? This is where it becomes quite exciting. Early infection detection. So, one of the biggest challenges in diabetic foot infections or foot care or foot wounds is determining, is this wound colonized? Is this wound infected? Is this wound has an infection that is spreading? So today we rely on clinical examination, imaging, tissue cultures, and inflammatory markers. But cultures can take days, they can miss organisms, and can be affected by antibiotics. So, a liquid biopsy could potentially detect the molecular signs of infection faster. Next is it can help identify dangerous inflammation. Not all inflammation is bad, as we all know. Early inflammation helps wounds heal. That's why it's part of the wounds healing process, stage two, right? And chronic inflammation prevents healing. So diabetic wounds are often stuck in that prolonged inflammatory state. Liquid biopsies technology may someday help identify the excessive inflammatory signals, the impaired healing pathways, and the immune dysfunction. I mean, we kind of do that right now, but this could help clinicians be like, oh, this wound needs more than just a dressing change before it gets too bad, where you see pus and purulence. Now, predicting which wounds will heal. I believe every wound can heal if you have blood in your body and you have a live body, a beating heart. I believe that the body does try its best to try to heal. You just have to remove the blocks that are causing it not to heal. So one of the biggest questions in them salvage is, will this close? Currently, we look at wound size, perfusion, infection, pressure, glucose control, and nutrition. But healing is biological. So a liquid biopsy could potentially identify growth factors activity, cellular repair signals, and regenerative capacity. So imagine being able to identify a non-healing, or I wouldn't say a non-healing, a stubborn wound earlier and intervene months before failed treatment. Now, another thing it can help with is personalizing wound care. So today, wound care is often try treatment A, and if treatment A fails, move to treatment B. But the future may be your wound biology shows that this pathway is failing, this other treatment is most appropriate. So it can help with your precision of your medical treatment care to help the wound close. Now, could liquid biopsies replace wound cultures? Not as yet, and this is quite important. Liquid biopsies are promising, but it does not replace a physical examination, does not replace tissue sampling when indicated, does not replace imaging, and does not replace vascular evaluation. Diabetic foot ulcers are quite complex. A test is just a tool to help aid us in making a better decision for the treatment plan for the patient. And a clinician is still a person who's interpreting the whole entire picture of the wound and the diabetic foot ulcer. So, for the future of limb salvage, imagine a future wound clinic. A patient arrives with a diabetic foot ulcer. We evaluate their circulation, their pressure, their biomechanics, and their infection. But we also may be in the future able to obtain a molecular profile on their wound. Within hours, we would know if there's excessive inflammation going on. Is their immune system responding effectively? Are there bacteria present? Does this wound have any healing potential? This could be the future of wound care. So, what are some of the challenges and limitations when it comes to a liquid biopsy? We need to discuss the reality. Liquid biopsy still faces challenges. The cost. Advanced molecular testing is quite expensive. Accessibility. Not every wound center has this type of technology, okay? Standardization. So, researchers still need to determine which biomarkers matter, how to interpret results, and when to change treatment. And clinical validation. Large studies need to be held specifically for diabetic foot ulcers to see if this actually helps and aids in the treatment and precision of treatment for diabetic foot ulcers to help them heal. So, as we know, diabetic foot ulcers are not just a wound, they are very complex biological systems that exist. And for decades, we look from the outside. We look at the depth, the size, the drainage, and the tissue, and the patient as a whole. But the future may allow us to look more inside of the wound story. A liquid biopsy represents a shift from reactive wound care to predictive wound care. So the question may no longer be, why isn't this wound healing? But the question might be, can we identify the biological factors preventing the healing before the limb becomes at risk? And this could be the future of limb salvage. So I hope everybody loved this episode. This has been Diabetic Foot Files. I am Dr. G. I know this episode is quite short, but I hope everybody liked it. The future of limb salvage is very exciting. It's very futuristic. And take care of your feet because they take care of you.